before beginning my epidural insertion, I'm going to perform a complete chart review. I'm going to make sure that my INR and my platelet count are the normal range. My platelet count is above 50,000. That there's no current anticoagulation therapy, that there's no contraindications. I'm going to verify that informed consent has been obtained and that preload of crystalloid has been given to the patient already. I'm going to confirm her allergies and ensure that all the monitoring is applied properly. She's got her blood pressure cuff, her pulse ox, and her EKG on, and my alarms are audible and on. I'm going to position the patient in an upright sitting position. The spine is going to be flexed forward into a kind of like a letter C. The patient's feet are going to be kind of supported on like a footstool. Maybe she's grabbing onto a pillow or something like that to make her comfortable as possible. Once optimal positioning is achieved, I'm going to kind of palpate the superior aspects of the iliac crest. I'm going to identify L4, and then I'm going to go to the L3, L4 interspinous process and kind of mark it with my fingernail. And then once that's done, I'm going to do my hand hygiene. I'm going to get my mask and eye protection and my hair cover. And then I'm going to get my sterile gloves on. So mine are already out of the packaging, but normally I would do a sterile glove donning here. And I'm making sure too that my assistant has, or myself has opened my tray already for me so that once my sterile gloves are on, I'm ready to go. So I'm looking at the contents of my epidural kit without contaminating my sterile field. I'm just going to go ahead and get my syringes together before I do anything else. So I've got some cleaning that I'm going to do with the patient. I'm going to kind of place some things to the side for myself. Let me put my drape here. I'm going to, this is iodine, but normally chlorhexidine or something. But iodine works too. I'm going to scrub, toss, scrub, toss, scrub, toss. Wait for the 3-minute dry time. While I'm waiting for the dry time, I can go ahead and assemble my syringes. I'm going to get a 3 ml syringe of some 1% lidocaine to localize my area. So I'm going to prepare this and also make sure that each of my ampules are handled by my assistant only. So I've got my 1% Lido drawn up. I've got my 1/4% bupivacaine drawn up in my 20 ml syringe. And I've got my 1.5% Lido with Epi drawn up in a 5 ml syringe for my test dose. So I have all that ready. I'm gonna kind of just place that to the side. My patient's ready. She's had her dry time. So I'm gonna get my drape. And I'm gonna make sure not to touch. Okay. Right over. This obviously might be a little higher. Okay, normally I wouldn't touch anything else and the opening would be kind of down here, but I'm just kind of trying to keep it from sliding off. So now at this point she's draped, so I can kind of refill her iliac crest, make sure we're still in the right position, and then I'm going to take and localize her. So I'm going to kind of insert this. Like I said, it would probably really be down here. Make a little skin wheel, kind of inject toward the umbilicus, and after the skin is anesthetized and I've kind of given that some time, I can start with my epidural needle. I'm going to kind of like reposition my drape a little bit. So, and you may see me like kind of leaning on it, which I know is a no-no, but I'm trying to keep it up. So, taking this, I'm going to insert my epidural midline through the skin, through the subcutaneous tissue, the interspinous ligament. Might feel a little bit of a gritty resistance at the ligamentous structures. The needle's midline and it's not wobbling, so I feel good about it. Again, ignore my drape right now. But once the needle is kind of properly seated there, I am going to attach my syringe, my glass syringe. It could be filled with saline or air. So I'm going to remove that, and I'm going to attach that with a little bit of air, and I'm going to kind of do this where I'm kind of feeling for a loss of resistance, and I have it. I've passed through the ligamentum flavum, and I'm in that epidural space, and I'm confirming again I got loss of resistance. So I now know that I'm in the right spot. I'm going to take this off, put this in here. I'm going to thread my catheter, making sure not to wave it around, but I'm going to kind of thread my catheter in. I'm going to push this about 4 to 5 centimeters beyond the needle tip. So I know that my needle is about 9. And then this is probably 11-ish. So I'm going to go to, try to go about 12. And then once I'm kind of there, I'm then going to pull out, but all while still pushing this in so that I don't pull my catheter out with it. Also, while all this is going on, I'm making sure that I don't have CSF or like blood leaking out, and I don't, so I'm good there. So I'm going to hold on to my catheter, flailing everywhere, and I'm going to take this off. So once I've done that, I gotta attach this. So I'm gonna attach this to the end. This to the end. And I kind of also remeasured and kind of advanced as needed with my measurements that I made, knowing that my needle was 9 and then I need to go 3 to 4 pass. You know, I kind of made sure and I measured and I advanced a little bit as needed. So I have my end on here. I'm going to take this piece off, and I could put the filter on if I wanted to. And I'm going to aspirate, make sure that there's no blood or anything. I'm going to do if my aspiration is negative, I'm going to do my 3 ml test dose with my 1.5% lidocaine with Epi through the filter. And then I'm going to confirm that it's not intravascular or intrathecal. You're going to wait about 3 to 5 minutes for any changes in heart rate or blood pressure, anything like that, any signs of, intravascular injection. I'm going to make sure that my patient is not reporting any like numbness, tingling, anything like that. And if not, if we're all good, I'm then going to aspirate again just to check. And then I'm going to do my 0.25% bupivacaine, just in 5 ml increments. I'm going to observe the patient between doses. And then once the full volume is administered, I can take all this off. I can put the little foam piece on here, and I can kind of tape it down, kind of put it over the patient's shoulder, kind of secure it using a sterile dressing and some tape. I'm going to test and document the vital signs, the level of sensory block. I'm going to ensure that the patient's stable and comfortable. I'm going to document the procedure, including the insertion level, the loss of resistance depth, the catheter depth, and test dose response, medication administered, total medication administered, and then the patient's tolerance of the procedure, as well as just any complications that may have occurred. And that concludes my epidural insertion demonstration.